Welcome back, everyone. The odds are not in women's favor when it comes to experiencing pelvic floor symptoms during pregnancy. Joining me now in the sponsored interview is Dr. Carolyn Swenson from U of U Health to talk about the symptoms and how they can significantly disrupt a woman's life. We just had yoga, which can help the pelvic floor. Let's talk about what area we're talking about, what this means for women.
Sure. I love this segue. I'm so excited that you had that segment on pregnancy and yoga, because that's so important. And in terms of keeping the pelvic floor healthy, so the pelvic floor really is this group of muscles and connective tissues at the bottom of the pelvis that helps support the pelvic organs. So that's the uterus, the bladder, the bowels, and the pelvic floor also helps us hold in urine and stool. So in terms of vaginal delivery, during vaginal delivery and even during pregnancy to some degree, the pelvic floor structures can undergo pretty significant straining, and that can affect their ability to function normally. So sometimes this results in bothersome symptoms like leakage of urine, leakage of stool, and pelvic organ prolapse, which is when the pelvic organs come down into the vagina and sometimes through the vaginal opening.
So 3.6 million women suffer from this, or they give birth in the U.S., and experts say 50% of those women suffer from these pelvic symptoms. But I would argue more than that. Many, many women, I'm sure that number is higher and people don't talk about it.
That's right.
But it affects so many moms out there. What help is available?
Absolutely, and that was kind of the motivation behind the University of Utah starting this Upward program, which is the first program of its kind in the Intermountain West, and it's really focused on prevention and early treatment of pelvic floor symptoms in pregnant and postpartum women.
So who is this for? Is it for people and women who are pregnant and postpartum, both?
It's for both. Most of the women we see are postpartum, so we see women within 1 year of delivery, but we certainly see women who are pregnant as well, as these symptoms can kind of first show up during pregnancy.
Is there pain involved when we're talking about these symptoms?
It depends. So we see patients for a range of pelvic floor symptoms, from leakage of urine to prolapse. But we also see women who have extensive tears that happen during delivery that involves the muscles around the rectum. And those women can be at increased risk for wound complications and wound healing. So we see women for those issues to kind of help manage those as well.
And doctor, there is that program you mentioned, Upward. This is the only one of its kind here in Utah. And so this is really important for women to maybe take note of.
Absolutely. It is. I am so excited that we have this clinic. It was started by a colleague of mine, Dr. Hill, in 2019, and it really is a unique resource for patients to really help get them the care that they need.
So this healing process, what do you do? What activity is done in this program?
Yeah, so patients who see us in Upward can expect to meet with either myself or my colleague, Dr. Hill. We'll get some information about your delivery, we'll do an evaluation of your symptoms, and then we do a gentle exam where we're really just looking for wound healing to make sure that everything's healing well. We'll do an assessment of your pelvic floor muscles as well as pelvic support. And then we do a lot of education. So if you've had one of these tears that involves more extensive injury, we want to make sure you understand your anatomy, what exactly tore, what your personal risk factors were for that tear, and what we can do in the future to help minimize your risk of further injury to your pelvic floor.
I feel like every woman who wants to become pregnant needs to see you before it happens, right? So what are the results, people who go through your program, and the impact it's made on them?
Yes, so we help facilitate a lot of referrals. So our pelvic floor physical therapy colleagues are really the mainstay of this program. So pelvic floor PT really is what helps rehabilitate the pelvic floor. It's so important. So one of the big things we do is help get our patients to PT.
Make that appointment right now.
Yes.
That number is on your screen, 801-213-2995, the uofuhealth.org/upward. Dr. Swenson, thank you so much for talking to us and talking through the sensitive topic.
Thank you.
We appreciate it. All right, thanks to U of U Health, meanwhile, for the sponsored interview.